Mrs. Mame Ewurabena Ansah, our specialist clinical pharmacist. Good morning.
Good morning. Watching I'm not
okay,
pinking boho.
Okay, and tell me the pen talker.
Oh, there,
me can campaign no keke. Me masha pink. Now I campaign near Odiano.
Oh, pinking boho. Okay. There's a black because he near brepa.
Say, I am for no call war near some cancer. My ya no den pa na mushituntum. Mode kokona to tototumo. Na pharmacist mo dwumadie anything you can so be a pharmacist cra or no anywhere.
Okay, nti is it medasi memobia good morning and nti yakada obi a pharmacist a healthcare professional who have been trained to have some expert knowledge in medications. All our knowledge, all our study has to do with the medications and how best we can help the patient taking the medications. When it comes to the medication, the drug production is a be in Drunankasa and should research into a drun. Yamo Drunusa, Abazin a drun or your Abansu so how you butum ye too far on Madame Sanson on bow cream. Say for a drun some pedum who day drunamazamon or boana on bow. So bows are Abazin and Mesha meet me who day a drunamazamon or bow. Instead of Yamania and a pharmacist ye. Whether say be a Nippon or community pharmacy or hospital and or your research and academia or your marketing, as in there or pede at the end of the day, they do not measure or bob enya and wounds and so. But my could do a wabra pede make sure they do obey Jumamo. I didn't say if you do.
Internet is a you walk or so to drink quiet the amount quantity and a pharmacist.
Oh, there, and some of them doing crab amount. More questions, maybe sour. I don't remember there a bed made you or by Joanna Angel. Because if you are back at okay and a pay a be a wide or me a finger meal. Maybe say Abazi, because I can't wait for now. It can be anything.
Yes.
So I need to know be about time no chassis, about when I say about time no see a matching and also an or a time it is an easy. The margin I bet shem a do cry be a mutum I recommend them all there buffer the madry. Into I be a bay and the ammo, but the baby so insane because me bisa a be a dynamic woman over hall. Inside them bisa. To be hard by a bis and questions, if you back a day. A bit air honagin, but in Pedem who died a dear Mazemowi. If you don't be no catch out there, me a finger me own, they made you me fair or Jim. But if you also wasn't here, Shronko. Into the made you a be on you, because Obia, ye, if I can be individual. Much more for paracetamol on Yamshi, but if you before for paracetamol, when you have serious reaction and showing ya a beer over whole nipan. Into you make sure they do not measure or a day if you measure more keke, but in pedo or ball. Let me pay the no hunsun.
Right. Inti not to say a nuna yebeba near Babatona enye by prescription from a doctor no. Yebabi dra muno muwea modebe assesse ana sign no na say no ni nyina be e a first aid na say continuous treatment and na we be am here prescription from the doctor no. Ana say a be any first aid cry. Okay,
see when you be a referral over the counter medications.
Okay.
In get a prescription, a bit macro pharmacy ne yes more. But on the crampo and son a be yes more, you baby so questions be because ebane kadebia me pay a painkiller, a be a acobo, a very strong painkiller. Maybe so there Ajinbia also one and if the maidry if I be a wifin or because Ebia in there with your hunam yo, a bit my fed maidrin, but beside the maidrin angel. It's maybe so there, oh, a do afanda, a fan abazin oil. Mark there, okay, Ebia, so also one on your them painkiller bobo, emo no bobo, Ebia Yarby who a hypertensive patient, a diabetic patient, on your painkiller be no be able to my fat. It's even though I over the counter medication now, Ebaba without prescription, still, I didn't be so there. maybe some questions be a bit too far and into me far.
Okay. Now the month of breast cancer awareness and the fight against it continues. Ruben and more as pharmacists more play in the fight against breast cancer. Okay.
Into pharmacist, one of our major role is that apart from the as in we are into health promotion, patient education, which is all part of our role as pharmacists. Right. And in pen baby, by the time I be sent about a hospital now, who the breast cancer may be a watcher. With is in why advanced, and we know that early detection saves lives. In the end, we there say, "Yakadi better hospital near Chanma debia wa bar, if you want to be elite." But we want people to be able to not just survive but thrive after breast cancer. In the end, we there see as Yankadi at na hospital yet in the community pharmacy near Chanma wa bar. See, Yankasa ye near Yakaka and breast cancer was them. So the who there say who there BBR quachuo, if you win for Hunaza mention. Bra. And we want to create the awareness to the point where it's easy for people to come out. And the people are maybe a woman fall. Maybe you'll be from oh, why did me see him yell? I suspect they be a malaria, typhoid, into medical hospital market check. But say, baby, you'll be named for I suspect breast cancer, medical hospital, because all you do on the cancer, aging cancer, the next thing they're begging the muwani. So there's a lot of stigma around cancer. So even though on your independent faulting or your profession, it was better one when you be a 1 year crack and I want you one can. By the time I was about hospital, you be shane we reach it. In CC, your car, your bonde coping timer, it becomes like a household name. It's not difficult for people to come out. It's easy to be able to have a health facility. Oh, the mice in oil, one shall not share there, Abia, so Bible control her and annoy them. In CCI, we are doing a lot of health promotion. In America's CCI, there's even some ladies, pharmacists who are at the Civil Service Ladies Association, CLOSAC, where a health talk on breast cancer. We are doing a number all over in our churches, in our communities, just to create the awareness. Because CCI cancer still is true kakao. But yes, but it becomes easy for people to come out. And that they would have a lot of people surviving and thriving after breast cancer. Internet, you were here, you're today, breast cancer, yes, but we need people to be able to come out, talk about it, and make it easier for the people that are going through it to also come out. Because they be a be, but on cancel, true. Because even though catch maybe I want to be faint at work, because you are not able to, even the outside the population, can they accept it? Because if me catch the mazin Amerikuma, I'm telling you because I want a support system.
Of course.
But say me reach ban when ankasa a weaker. Ten obodregu. I'm so cram at mabufum. But we need that support system for them. So until we create a lot of health awareness, health promotion for cancer to become easier to be talked about, we'll have a lot of people hiding it. And then our cure rates will be less. But you pay your bond there. See, I am Chanman Corfon by Youngsa Yarko. Baby, I benya a queen Yabutuma Cassan, a pede Cassan and Corfutum. It becomes easier to share their experiences and everything. When
you say more expanded, more threats, marshal, more moving, come on, any other day. We saw a quenya at least 80 home come on, Yaman for Bebre, Ecusu Shetty. And he said, omo ye practical nkomobi ewo baby near there yes yet here you know there na bit to me aye kakra de be kreti na ma ya adwan ba ho so then na bit me dey church Ghana for na ma ya adwan ba ho so kakra ewo breast cancer no.
Okay, me da say enti ma ye be kan de on de be say bia e dey wan ka say ehuhu. You should be able to know how your breasts are. Say you should look at yourself and see is there any abnormality, because how your breast, the size is, the shape and everything, there are certain signs that the mazi on your normal, because see say when they starting way no fu a cry cases in a current it don't no we control and as one second when they why the lamp be abim it don't make you check, because on your lamp be no cancerous. Instead, there's a corner washer. When there, Abia white today, and they ekutu no one. Okay, Mpocho, I think other slides will show there's a picture of a whole orange package. It's here just the anatomy of the breast. Pocho, you bet my queen kakra. Into the mazi, into a bohun there, a be a cruby aba, when you for say crab when they could know you, but that crash in the crew, a there's a hospital check. And when the lamb be a when they be a strange discharge. We from him, it be how today, why the milky and I beat the why the moja. It does cost put in wash. When they be a no dry a cocoa and a baby hyzin, and why the baby why the baby hyzin wado, why the rashes be an incident task and a watum, nifunatum, and a bunda one nipple no so wakishim, yes, wakotum. Into anything that is abnormal from what your normal breast is, and there's a connection. And the main thing, what even though sometimes the baby obey today. Enu finankasa no by today ekutu on the ekutu is no one why do what to make it be or the bu de nufun what to make it into any sign that is not normal you must go to a health facility man fa nsha wo man ka do the mazimerishe because as I offer counseling when there or abnormal cells are onyin once one town once onyin akọ kwa na oroko onyin nti from the breast or wherever it will grow, it will grow. Into kakane hunankasa for hospital and share. Into be or the baby can just take out the lump and the breast is saved. Oh, the baby side might have to take out the whole breast, but there's still life after that. Into any sign that you see that is not normal, mention, man, you be all about hospital. No, I no bear 3 months, and I bear 5 months. You be bear 1 year, baby son. No, but you must come out. It's because of the fear and the stigma. Yes. But then you come out and let's see how best we can help you because early detection saves lives. Yeah.
Apart from the physical changes, maybe nepono coincide, rashes will be going abnormal, and maybe some pain near the other. And now, which say lampono, a year but one that before mono, and yenina and a cancerous. And me oba na bajwa ewo menufo mu dadamo me say na mesi ya cheke na how na mesi me determine so we know ye bajwa bia abnormal from bajwa ewo hono dada.
Okay, in most of the time no ye beka there how you examine the breast is very important. In TB or how you can either be in a lying down position or you are standing up one side to you say it in front of the mirror. Okay. You understand? And then palpate when you okay, so you go do her. On the way me entire one side them and them because them that you form lumps on and you one side them in sun them
the bro for no say
yeah more like you're palpating
okay the bro for no palpating
in say and them and we are focusing not only on the breast but towards the armpit. In TV or how you do it in, you can either actually you are in a circular motion, going around, checking all these gradually, then coming towards the middle part into where the nipple is, but not forgetting your armpit
area.
Yes, because your BBI friend lymph nodes, there are certain small organs that help to. If it is the cancer moves, it moves there and spreads to the rest of the body. And to be on should die in ya lamp or nenufum, but everything won't suffer for one more as you feel a lot of lumpy things, tissues within the armpits, and that will be even the sign. And to be what happens is that after that, when you go to the health facility, yes, they do it sometimes obey today a biopsy. Be was a needle. Was I said tissue no tissue no yakosho lab mashe the mazen no hon is it cancerous or not unable to me hu be ho baka da okay ubeyi if you want to be lamp in ankasa wa kwahwem say that as you know cancerous and now cancerous, and that one lets us know the stage of the cancer because if it's just located at one location of the breast, it's it's localized. This is why spread out lymph nodes move, then that determines even the treatment that is given for you. So no matter what you are feeling that is abnormal, I'll kind of one check, because there are times when you can be breastfeeding you could have an inflammation in the breast, a referent mastitis, right? So you might feel something lumpy in your breast, As a hospital, it's just an inflammation. Yama windrew no call. But anything I know there, we need our own focus. So we advise women that at least every month after your menses, always do your self-examination, because that is the first point of call. Yes, to know that something is wrong. You look in the mirror just by observing it, and then you do your self-breast examination. Anything that is not normal, see the next health.
What about the visual? Me who say bonus at the man, especially omo breastfeeding.
Yeah.
Or say a toda it me
inflamed. Right, the one when kakra.
Okay. Now I say yaw kakra.
Yeah, kakra.
But I no mobile hospital.
Yeah.
Now I say pharmacy cry na.
At the hospital, most of the time, what will happen is the ABI will be a scan, breast scan, right, to check and see. There is just an inflammation. One more antibiotics. Everything resolves. Yes.
Okay. Well, since we are pharmacist and in an unfortunate situation, will be diagnosed with cancer, breast cancer, and you're treating every year. And as the surgical system is done or surgical operation is done, if you want more corner, how do you as pharmacists assist such persons to manage the recovery as well as ABS to as a crack na mumu roles and mu play a motise?
Okay, into say your breast cancer treatment, it involves, as you said, the surgery. Then you have what we call chemotherapy using drubia oboku cancer cells. Then there's radiation therapy. Sometimes depending on the stage of the woman, it be into the tumor is large, and when the tumor is large now, want to make surgery immediately. Yeah, they are more undruna obe ma lamp na shrink. Into a chemotherapy, drubia aboma tumor why kakraba it me a surgery. Into for some people, you can do the surgery first when the lamp is able to be removed by an operation, but for others you go through the chemotherapy, and these are in drubia. When drubia from chemotherapy, what they do is that cancer is a fast growing cell, and see chemotherapy drugs and they will fight against the fast growing cells, the cancer cells. But one thing is that apart from the cancer cells, in any other cell onion in term will be affected. It's a bone there be it grows fast, so we give the drug all cancer cell no would seem cells and now your blood cells into the eye anemic. It's because of that, and the side effects of the drugs, we come in to ensure that you pede moto, but you pede ebre. Into the side effects associated with the drugs, we come in to see how best we can help you to ensure that you are going through your treatment, but you are also safe and it's tolerable for you. And to be yes, the side effects are befi. And to say so a young put on easy, but you are going through this treatment for long. So we look at the drugs that can cause the nausea, and we give you the medications to reduce the nausea. It be and son about doing years hour. A year so I need to be a mouse book of fee. Near how to take it to ensure that you pay the coffee and feed them because they be in a break. Be a young woman just so but so until a woman drew and you better check certain labs to make sure that whatever you need you are catered for. Some go through pain. It's a special pain management. Right. They may draw a board and on board as we manage your side effects as well. And we help them and the education, the counseling, the encouraging, because it's not easy going through the treatment. But we know that you are there. A friend, you are taking the drug, you are finding certain issues with it. Maybe you are catch your side effects, but ABS say why we bring more than what we told you. You come back, you call us, we are able to there to support you and give you the necessary counsel to it.
Last week, focus on cancer in men.
Yeah.
And how deadly it is. And home education and church bibia at the buyer. Yeah, me man of Freya. A man will so every FM and Emma Konya no Abba. Nkomoka kra ho with me afre. Wa hima team na esese baby a de fa no na o maboa de afa ho no e de amount. So we between so the WhatsApp and our text message and so aba na akenkan na otumi aboa na wo hunu baby afutuo no ebesi afa anase besi akro enti 0263 404018 and 03029588 94 obetumi afrɛ so na yɛtumi ati wano disem na nkɔma wɔ hɔ no so no mu afutu a wo mu bia no yɛde ɛno so ama anɔpɛ ɛno akyi no WhatsApp numbers no 0551 55 5506 na watumi asend a message anas text anas WhatsApp na yakenkan yɛde ama na because of segment I woman into no more other messages in any WhatsApps na aba no making kan wa bra program no economy ye mo amodi o Facebook ni ade ni nyina program no economy ye no making kan na yafa the cancer focused ones no na doc etimi ayiyima no we also then also Lucky TV, you are the best on okay. I'm call home so me cover I can kind of the amamo. Pacho, do any baby I can say free?
Me pacho me kasa free touch mine. Ono east.
About me pacho we know.
Me pacho me de Mabna
you two on pay.
Me pacho at the say you see as wo more cassava breast cancer. Na so mawo me wono fo bani bi. E wo me mo chuo mo wono. It is am no fo bana e to da ni breastfeed me bana. Kaya na e de say me no fo so ni bi free me mo chuo mo wono. E pie ba. By me enya me ya. They say mawo sis. And so enya me ya me breastfeed me bani bia e so free mo wono mo ba. As no one of Fubana Espa, and to Sana Express a breast cancer by me, Fury Prince be a cat to send me enough for now, and another day, and I may have found.
That's it. Robina B, you are no every promo 0263 4040 1803 958894 and I will be so send a test or WhatsApp 0559 55 55 06 na dear Kosono also near the home and come Osempa.
That's it. Mama can you there focus with no and check and share. Because it's a mechanic, yeah, there are signs that will give you an indication that something is not right. It's there's something that is not right. As to whether it's cancer or not, to me for you and shiny academic cancer. But Macadam man find some who them focus with me won't show no one show more. Because I'm the watcher one who is all cada or supan. Men friends agre, I have focus near insano precumo. Into on the macacha mabinade is a messiah. Mama azinchi onko ni enkohwe
baby okase ase nsu no momba no during breastfeeding no there more encounter and as a doctor no more encounter and as a peculiar
it's quite peculiar because it's ideally we know that ABI is a mechanic. There are some lymph nodes that if the cancer it can be affected, but there for all this while or while the breastfeed of him then it could either be there's a leakage somewhere, but it needs to be checked. And someone wasn't on call.
So Obi was would you never be a free? Hello?
Hello. Make a it's my friend idea.
It's your buy, about any day woman on a suka crown for my. Yet you are buying. Aya enya den
like in
and maybe ana no na kum na sa na tie dada na se sa na tie dada okay amen ko
okay you see nakasema bbc 9 because it be naturally nene ponu oshim it is not abnormal because them not said there is no problem. But say oh yeah, the one that is out and suddenly who there wakeshima on Obama wajuna about the baby culture. But naturally there are people that have their nipples inverted and it's normal. Yes.
Okay, over him auntie oda no other. But we na bibi fufu.
Bibi fufu muma ne.
Obi also would any baby akase free. Hello.
Hello.
Yes, good morning. Would any baby akase free? Oba yetu anope o ma wano so kakra mai o ma munya den kakra mai.
Pacho hotel Vic, we kapati kuma.
Vic yetu.
Pacho medicine no wa I say India the I say me and yaw. Pacho me we say dia. Bibinia.
Okay, Entino.
Intin Pacho say also oil and also. Intin make a bit of why it can just be an infection of the breast. But once on your normal, not or no banocon, or those who can wash it. When you be no breast cancer, so it can just be an infection, abscess. Right, the why the pump will be a woman, BB. But when there's hospital near she, you to the old bill or best scanner she. You may withdraw or boko. It's more function. It's uncle me and Koshe.
Na yen Ghana for no. Toda yanko ni yanko hekeke. No me koyo kra o ma anya hwe yesi bibie ni hono ma ji misika. Say something na motene da. Now so think say knowledge is power.
Yeah.
Nka wo hunu say said the course or any share cry no, said Nippon so ye juma, no wotuaneka. Tenanko wada nyamiasa say will be a war expertise and I say Nimdiana Hunumo, or the abo more home bobre. And so, we young coy was say hello. Obidina Homano so would the other be like as a free? Hello? Hello, good morning. Answer on Tianka. Right. Yes. Wahoma no etwa sisinti enshada ntonka obeda ho kakra na nka washa ase amaya. Ose bako ayeden.
Bako ya
And sana tia dada na.
No de sana.
Oh, okay.
One is because naturally say yenya yehwe ye ho bohu de enufu na nkasa. One is naturally slightly bigger than the other, which is normal. But say onye dam not in a studying who de e be why kesa achin isort na why kakra ba achin mi sort na ho na bohu de maybe recocho. But naturally if everybody looks at their breast, you realize that one is slightly smaller than the other, and on the whole behind you. It's a monster.
Right. Good morning. Would you anybody be free?
Hello.
Hello. Good morning.
Good morning.
Yes. Would you anybody be free? Hello. You too, pa.
Good morning.
Good morning.
Pacho, you abandon them. Na me say photo and answer sanity. Or say them to collaborate.
Na enya ne ya anase nsubi amfiri mu mba ne ade enya ne hwe you gusu dot ho ha say right okay wait me ato so na enya ne hwe nsubi amfiri mu ma ne po no so nkan kwhye mu
Banam ka say so dia kare say info ka babia inside madam bi
say so we are nka babia medan no for no mu bio is that a myth or is it a fact? Okay. Open your would have fatu so the team come on.
It's a bit, and see, but it's okay about woman. I watch her for years. Since I make it, if you are on your cancerous, we call it or benign.
Yes.
And see, on your shoe, on your cassie, on your cacao, dim the man. But it is good to, even those ones, we just want to even remove it. So you went down your cancer, but just want to remove it. Because as to what will trigger it eventually to become cancerous, will be So even though there might be a lamb that is not cancerous, normally we advise, depending on the size, you feel no one to.
Okay. Nti afutu ya sabu bako hospital no akohwe mu na akrach obi fufuro gina so frefo twato nie wodi ene ba bi akase free. Hello, good morning. Emsa na homa no edi ni hwambo say de no so afacha ye. Hello. Mano de Shamonti. We say hello. Please, I'm Benis from Kaswa. I've been experiencing pains in my breast, especially at midnight when I sleep. And when I want to turn myself the other side, that's what you're trying to imply. It sometimes becomes tender and large as if I breastfeed a baby. So clearly she's not breastfeeding. And also no photo. Okay, so naturally what happens for us as women is that just around your ovulation period, there's a lot of fluid accumulation in our bodies. It's naturally around that time. It's like the body preparing yourself for pregnancy. So you realize that your breasts feel more full and a bit tensed and all that naturally. Then you realize the moment your period comes and you menstruate, all those symptoms subside. So I would want to know which type of her cycle that she experienced these things. If she can identify that it's around the cycle, then it would be the normal phenomenon that goes on in our bodies when we are ovulating. But if it's not around that time and it's becoming frequent, then is there anything going on? But naturally, during the ovulation period, you realize that your breasts feel fuller, more tender, it's one saccharide or your kakra. But the moment you're out of that phase and you don't take seed, if you take seed, then it's preparing for the baby coming. So it remains full all throughout the pregnancy. But if not, it comes back to the normal shape and size. The tenderness goes down, then we have back to normal. And see, if it's not within that time, I would advise that she just walks into. Now we have a lot of these reproductive health units in the hospitals. You can just walk in for a breast examination. Right, Doka kind of simple cry there, Senya women's so time na yes, Ostrawada, Fako Hospital na woman to me and share and famau. Messages no bebre Masha said your free Facebook, so na me the ababi P WhatsApp any test. Was it a frequent and yet a menstrual period nkwa that is so hospital into your him me so doctor say ye na ehwe na kokra ho well menkin kan ebia abeba no we say Emmanuel Martin radio Abrempon from Kwautafo see the rate at which the dam spillage is doing harm to our people in the Volta region is very sad. I know this is a natural occurrence, but human activity is also a key element necessary to combat going forward. Or say agencies and institutions must also do well to convey necessary announcement at the right time, save the affected communities. Also greetings to Honorable Brian Echampong. All right, thank you for your message. Bonsukrum SL or message now what the abano HSI Aquania or Honum and crack say was south. It's very bad roads and nowadays Casafoni a day Akahondiaba. Maybe you how bad it is. We say hi, good morning. I'm watching you live from Aninem Moseso Eastern Region. Say the CEO of Junior Armor FCO. Okay, that is Gladys. Right. Sami Boachi Asaman Keso all roads leads to Akim Swedro 29th October. The massive health walk organized by Honorable KK Wosompim, the controller, says the NDC should stop making the unnecessary noise about their desperation for power. The good people of Ghana are very discerning and still have the retentive memory about their incompetent ruling on some years ago when the really Mintimin kind of brofo no Tiano to boase na wachre same boache ya saman kese wo de becha me ho blueprint atro ne de free sika do ketan de aba o de ncha kese ekwama Honorable Charles Bisiu ono na dwene no the incoming member of parliament or says this government has really done well in terms of setting up factories since 2017. He's talking of about 296 one district one factory companies have been established, and other numbers are around 126 factory also operational, generating an estimated 60,000 employees for Guineans. Sinotrack assembly plant is a typical example, and a blueprint about say Capito from Patriotic Voices go. So there's still hope in the NPP government. So Guineans, let's continue to support them for better Ghana. Regards to Dr. Mamadou Bawumia, best and next to leave the NPP to break the 8 come 2024. We say, in fact, President Akufo-Addo have shocked me. People of Volta region are suffering and dying, and what concerns the President Akufo-Addo is vote. These people don't think about Ghanaians. Let's vote them out. Simply Ablade Fiekuma Zongo Takrade ND way by host of other messages coming through test and other place. Jacqueline who message in the virtual doc na the Umobiano on the home and Como. Thank you so much for coming. It's a pleasure. And then Kakraba Kanda Chagana for Nia Source.
Okay, that's it. It's a early detection saves lives. And see, and Pede and Crawford was the 1 year basha. And see, everyone there, breast cancer is treatable. And see, yes, sir, Miniamba more function. Let's be open. And for us as a community to let's support them. Because I think that is what prevents them from coming out. But when we embrace them and know that cancer is treatable, then it's easy for someone to share what they are going through. And if I share with you, you should be able to support me to live again. There's life after breast cancer. It's my hospital, but come early, let's help you, and so that you can survive and thrive. Amen.
Sponsored by Lucky V Care. Health Wednesday it's come to successful and a patramano said the name of BC the member chedi no to kru kakra dem coin them but the match chedi no coin bia nem you get the point and ana o hygiene so the memfe diagro cause your bar Champions League, you know, Subai no ho any other places ni nyina na kambo mo na ma sebiota frache o mayono ACP esita. And I would entreat you to fall on the Herbal-based feminine hygiene product Lucky V Care from Lucky Herbal Hospitals. Na otimi atoi. So we take a card to us awaswa Naija downtown constituency honum wakra ho kama semadu no machino na fe wapen so krojin bi edi agu ho na fe aboa ama bibia won say Champions League ni more da ayana sponsorship no so high atanso so bapa and sponsorship no consistent enti oyoba obakra ho na sebiota frache omayo no SCP esita. Right, my name is Ishmael Mubarak. Thank you for watching. Ochna Nyame Adoma is Hot Thursday and I have a package for you. Do stay with us.